you think about it, we brush our teeth twice a day. We go to the dentist about twice a year. We floss every day, we're supposed to at least. Imagine using your mouth to pick up everything you need to pick up and not doing any of that. You get tartar buildup, you get bacteria. The bacteria can seep into the roots. Once that happens, you can start having bone erosion. So basically the bone is eaten away. And after a certain while, you can have even abscess formation just by basically neglect of oral health.
It's very common. I think it's one of the most common diseases that we deal with, just because we're trying to get the importance out about dental disease, but I think almost all of my patients have some form of dental disease. A biggest thing is bad breath, which is usually the reason that dogs will come to us or cats will come to us for evaluation of their teeth. Other things are, more serious things are if they're not eating, if they're dropping their food, if you see any redness of the gums or the worst case bleeding of the gums, and those are all signs that you can see. Yeah.
For the basic cleaning, if it's a young patient, for example, we do scaling and polishing, same as they do at the dentist. We measure, for defects, pocketing around the gums, any teeth that are loose, any obvious fractures on the surface of the crown of the tooth, any mobility, cavities, all that stuff. So we measure, chart, and do all of that. And then, we recommend blood work always before surgery. That's optional for patients under 5. Patients over 5, it's mandatory to do blood work and mandatory to do full mouth x-rays.
So the biggest thing we need to talk about is either teeth brushing, which should be done daily to prevent, calculus buildup. Other things are dental treats. Dental Veterinary Health Association does have a little seal that they'll put on treats that do prevent dental disease. So it's like a little VOHC black seal. So I would encourage owners to look for those. Once pets are about 3 years old or sooner, if they notice any signs, I would like to see them once a year to evaluate their teeth, and then as they get older, every 6 months.
Yearly or bi-yearly dental cleanings at the veterinary hospital under anesthesia, so we can scale, polish, and do all the probing and measuring and charting. That's pretty essential. We keep up with it for a reason for ourselves. We should do the same for our pets.